Hi, good morning everybody. Welcome to today's webinar, Men's Health and Wellbeing in the Workplace, Raising Awareness and Creating a Supportive Environment. My name's Brad and I'm one of the Health and Wellbeing Consultants at Westfield Health. This morning we've got Professor Rob Copeland joining us and Kathy Lawson. Rob, would you like to introduce yourself?
Yeah, morning everyone, it's great to be here. I'm Rob Copeland, I'm Director of the Advanced Wellbeing Research Centre at Sheffield Hallam University.
Brilliant, thanks Rob. And Kathy, would you like to introduce yourself quickly?
Yeah, morning everybody. And that's how I said quickly there. Thanks, Brad. So yes, I am a mental health first aid instructor, have been for nearly 6 years. And I do other things other than mental health, but that is such a hot topic at the minute. So that's what I'm spending my time doing. And I'm Westfield Health's go-to person for anything to do with mental health. So great to be here today.
Brilliant, thanks Kathy. We'll also have one of my colleagues, John Joe, joining us later on. But just before we get started, a little bit of housekeeping. So the webinar this morning is being recorded and you'll receive a recording shortly afterwards by email. Everybody has been joined in listen-only mode, so if you have any questions, you can feel free to pop them in the chat box and we'll try to answer those as quickly as we can. You'll also see that there's some resources that you can download in the handouts section. So these include some men's health tips for employers, a Know Your Numbers poster, a mental health conversations poster, and a mini report called Unmasking Men's Health at Work. So during the webinar, we'll be asking some poll questions to include audience members' experiences. The polls are completely anonymous and optional, but we will share the results overall. And it's just quite an interesting way to learn from some of your peers too. So a survey will also appear on your screens at the end of the webinar. It'd be great if you could give us your feedback as we use this when we develop future webinars. So a little bit about what we'll cover today. So on Saturday, it was International Men's Health Day. So to mark this occasion, today's session will focus specifically on men's health. So what we'll cover some of the statistics on and challenges around men's health, how employers can raise awareness of men's health issues and create a supportive workplace culture, a little bit about how to start conversations around mental and physical health, supporting working dads and creating an inclusive, flexible working policy, and the power of workplace, how employers can support and encourage male colleagues to access health and wellbeing services. So just to set the scene a little bit, here are some of the key stats about men's health. So one of the first stats that we've found is men have the tendency to put off health checks. So one study found that women are twice as likely as men of the same age to have registered their GP in the past 12 months. And 84% of men only go to the doctors when they're really unwell. Prostate cancer is the most common cancer in males in the UK. Men are 3 times more likely to die by suicide than women. Men are likely to use drugs and alcohol as coping mechanisms and less likely to talk to friends and family about their mental health. And men are twice as likely to have mental health problems due to their job compared to problems outside of work. Our Culture of Wellbeing survey that we conducted back in June also showed some interesting findings about men in the workplace. So only 15% of men have taken time off due to mental health, compared to 40% for physical illnesses. Men report taking half as much time off work to recover from stress and burnout compared to women. Men aged 45 to 54 are the least satisfied with their current jobs. Men aged 55 to 64 are half as likely to be looking for a new job than those aged 25 to 34. So older men are least satisfied at work, but are less likely to look for a new job. So moving on, a quick question for you, Rob. So we've just shared some of the hard-hitting stats about men's health. there's still a lot of stigma around mental health, and the stats show that many men are putting off getting physical health checked regularly. Can you help us understand why there is still stigma around men's health, which may prevent people from talking about their health or getting checked?
Yeah, thanks, Bradley. And I think the first thing to say is conversations like this are incredibly important and also really helpful to raise awareness. What the academic literature tells us is that stigma related to health-seeking behaviours is really quite complex, and there's a number of factors that interact with each other that make it more or less likely for men particularly to seek help. And they relate to the individual beliefs of the person, but also our social and cultural norms. So how we create a narrative in our workplaces, specifically here, about health-seeking behaviours. What some of the evidence also tells us is that men tend to need a very specific reason to seek help, as opposed to these sort of broader general concerns, and that might help us explain why the broad church of mental health isn't necessarily engaged with at the same extent as physical health does. There's also some inequalities that we need to be aware of here. So men from lower income or from unemployment context, they also seek help less often than those from more affluent areas. And it's often, when we speak to men about this, as we've done through some of our research at the Advanced Wellbeing Research Centre, they tell us it's to do with the fact that there's a perceived sense of embarrassment or fear or shame around these help-seeking behaviours. That's often as a result of this idea that somehow men should be, I don't know, independent or kind of immune to these types of characteristics. And so it's complex, but there's some of the factors that influence whether men choose to engage or not.
It's interesting, Rob, because I've heard it said to me that until they start serving draft beer in the waiting room, guys are not going to the GP anytime soon. And I think there's also, you mentioned behaviours there, and there's probably generational influence. I see men of an older generation, perhaps after the end of the First World War, when they were very stoic. It would have to be seen as quite shameful or quite weak to start talking about their mental health. They were meant to be the strong one in their families. They're supporting everybody else. And so it wasn't the done thing to come out and start talking about their mental health and how they felt. I see it changing with a younger generation coming through. They're finding a much better language to talk about mental health. And I was interested in those statistics about men looking to change their jobs it was about the age 50, I think, onwards. And not to underestimate, there is also a midlife crisis for men as well. They get to a certain age and their families have maybe flown the nest, and now all of a sudden they're looking at the partner going, oh, wow, okay, what have we got to talk about then? And it becomes quite challenging. And as well, when they've been working for all these years, and maybe they've got to about midlife at 50, and they've not maybe got where they wanted to be. And so that's a challenge as well, thinking, gosh, I haven't got much of my working life left. What am I going to do now? So there's lots and lots of influences from a societal point of view, as well as the behavioural issues that Rob's been mentioning. So.
Brilliant, thanks, Kathy. We just had a quick question come in on the chat for you, Rob. Audience asking, is there a difference around men's health in relation to different working patterns, for example, factory shift work versus office-based hours?
Yeah, there is, and that's partly related to the broader cultures, and this may be something we touch on a little bit later, but one of the key factors is the culture that's created at work, this sense of what we call psychological safety, the perception that people are able to have these vulnerable conversations about what matters most to them in the workplace, and creating those, whether it's on the factory floor or whether it's in the office, is absolutely crucial. But there's certainly a relationship between lower engagement, largely in factory and shift work, compared to office-based work, and that may be a flexibility thing as well.
Brilliant, thank you. So we're going to move on to one of the first polls. So we're going to launch a poll, as we're interested to see if you've already been taking any action around men's health. So in the last 12 months, have you run any initiatives to raise awareness specifically about men's health? So you can choose from yes, no, don't know, no, but we'd like to know. And if the answer is yes, you can also leave some feedback in the comment section about what you've been running already. Got a quick question for you as well, Kathy, that's just come in on the chat. How much of what is being said relates to economic issues where the man is the main earner and cannot afford to be off work?
Gosh, that feels like a question where we could spend a whole another session on it. So, and I think Rob was just indicating, wasn't he, that different working environments are going to have an impact on men as well. And I think that things are changing because men are not always the main earner these days. I haven't got any academic statistics, maybe Rob has to support this, but I think things are changing where they're not just the main breadwinner, let's say that. And you've got women now who are contributing to the household. I don't think that whether men earn money or not earn money actually affects whether or not they're willing to open up and talk about their mental health. I don't think that is a main contributing factor, because if you start looking at things like suicide, for example, then suicide isn't discerning. It doesn't matter whether you've got no money or loads of money. So I don't think it's, asking that question in that way, I'm not sure that economically it's going to influence men's health to that great extent. I don't know, Rob, if you've got anything to add to that.
Only that the evidence tells us that those in lower economic groups tend to seek help less, and so it's important that we recognise that within the workplace, and there will be an inequality, and so much of that is within the work time. How do we create flexibility and space across our workforce equitably, so that all men and women, for that matter, can engage in supportive activity?
Brilliant, thank you. So some of the feedback that we're getting from the chat already about some of the initiatives is that companies have been running checks for prostate cancer, which is, brilliant to see. And as you can see from the chat results, 22% have already got initiatives in place, compared to 32% that have not got any initiatives in place. And there's a lot of companies that have not got anything in place currently, but as you can see, really curious and they'd like to get things put in place. What are your thoughts on the results that we've seen there?
It would be interesting to know whether, because you've asked the question specifically about men's health, it's interesting to know whether if you asked it more broadly about everyone's health, would it get a different response? Because are people specifically recognizing that perhaps men want a different initiatives in place to help them open up a lot more? So I don't know, it'd be an interesting one to run it in a different way, wouldn't it?
Yeah, definitely. I think from my perspective, obviously being a health and wellbeing consultant, it's fairly close as I expected. A lot of companies have got things in place currently, but those who haven't, it's been, key on people's agenda at the minute. They've been looking at wellbeing solutions. You've got health cash plans in place currently, so feels like it is very, very topical at the minute.
And there are specific services set up specifically to help men with their mental health. So you've got Andy's Man Club, for example, is a charity set up specifically to help men. And what I see is that, say you've got a working environment of a shop floor where men are just full of banter and macho and everything else. Actually, they're not necessarily going to pop along to HR and start having a chat about their mental health. So having a different way in is sometimes really valuable.
Yeah, definitely. Yeah, so I've had some really good suggestions, some really good feedback there. Could I just ask you, Rob, how can employers raise awareness of the importance of men's physical and mental health? Can you suggest some initiatives that employers could implement to help support men's health and enable access to services?
Yeah. So if we link this to what I was saying earlier about the drivers of help-seeking behaviours and men in mental health. So the first thing to do is to kind of debunk the myth that actually men are kind of immune to this type of thing. So normalising a conversation around men's health. I notice in the chat there's one of our colleagues talks about the fact that they run initiatives throughout the year. So normalising this narrative, ensuring that there's opportunities for people to engage, going where men are. So, you know, raising awareness through the urinals and what have you, and linking into kind of broader national campaigns such as Movember. I think the modelling from senior colleagues is really important if we're thinking about the culture of the organisation. So how can we make it easy? How can we promote it by managers and leaders within organisations modelling behaviours, engaging in mental health support services, and mental health first aid running courses and such like to make sure that staff are well trained is really important to create this sense of openness and safety in the organisation that you work in, to say, look, this is a normal part of our conversation, this is a normal part of our narrative at our workplace, and we want to encourage people to feel safe to open up and have these types of conversations. So that broad culture, making it a normal thing to talk about in the workplace, is really, really important.
Yeah, definitely. I think one of the main kind of starting points that I've seen companies implementing right at the beginning of their wellbeing journey, getting mental health first aiders in place. You know, it provides like a point of contact for colleagues, a point of contact that, you know, you can comfortably speak to. So I think for anybody who is beginning the wellbeing journey, your mental health first aid training is a really good starting point.
And absolutely, I'd be a huge advocate of that for obvious reasons. And it's good to know as well that there is now a version of the mental health first aid training that has a support app with it as well, which is superb, because it means that you are able to link in with other mental health first aiders. It's available 24/7. You can get information, support, advice. If you're in a crisis, then you know where to go. So yeah, it's being improved all the time. And as you say, it's good to have mental health first aiders, or just mental health first aid awareness for everyone, particularly managers, who, as Rob was saying earlier, role modelling behaviours are just so important.
Yeah, and do one final thing to add. I do think it's really important that we embed these conversations into everyday language. So this isn't about necessarily setting up a specific session to come and talk about mental health, because, you know, I'll tell you now, your attendance isn't going to be high. But if you can create opportunities throughout the working day, if you can get people exercising together where you can then prompt and start to feed in these conversations and asking the question about, you know, how are you? I think it's really important, again, just to normalise this as part of the culture. It's incredibly powerful. The sense of a social norm, as we call it in psychological terms, that it's acceptable and it's a normal way of behaving to have these conversations, is incredibly powerful.
Brilliant, thank you.
Sorry, Brad. I was just going to respond to Rob and just say that I think one of the reasons why people don't talk about mental health is because talking to other people, they feel like other people need to fix them, or people feel like, oh gosh, if I start talking about this subject, it's intangible and I don't know enough about it, and therefore I don't know what to say. And we all know, and you've heard me say this loads of times before, that when you say to someone, how are you? And they say, well, I'm fine, we know that that means freaked out, insecure, neurotic and emotional. It doesn't mean that people are fine. And so actually, as Rob was saying there, just ask again. You know, ask. I always have a rule of thumb: ask 3 times. Ask once, how are you? I'm fine. Okay. Well, are you really fine? How? You know, I've noticed lately things have changed. How are you really? No, I'm really fine. If you have to ask a 3rd time, you are not the right person, or it's not the right time. So maybe encourage them to speak to somebody else. So sorry, Brad, you were going to.
No, it's fine. We just had a quick question coming from the audience. So one for you, Kathy. Just asking what is the difference between mental health first aid training and counselling?
So the difference is fundamental. When you are trained to be a mental health first aider, it's a bit like being a physical first aider. You are trained to signpost them to get the appropriate help and support that's right for them. You are not trained to diagnose, and you're definitely not trained to be a counsellor. Counselling is a very broad area. There's lots of different theoretical approaches within counselling. There's lots of levels of counselling as well, where you can go as far as being a psychologist or a psychiatrist, which would be on the medical side of things. So mental health first aid is not counselling, definitely not. And in fact, it's one of the things that I talk to people about a lot, saying, I am not training you to be a therapist or a counsellor. I'm training you to be like a physical first aider, someone that can recognise the signs, that can signpost people to get help, that can offer support, that knows how to listen, and that doesn't need to fix people. So great question though, really good.
Brilliant, thank you. Another question for you, Kathy. How would you approach men's mental health if nothing has been in place previously?
Well, some of the things that we've already said is that sometimes it's about the environment that men are working in, and if it's predominantly male, then think about what is going to be most appropriate for them. So, you know, I often say if you've got toolbox talks or town hall talks, then start to integrate the language of mental health into your everyday language, the things that you're talking about. And then there's nothing wrong with doing some full mental health awareness training as well. And you might be surprised if you asked people, would you like to train as a mental health first aider? You might be surprised how many men would volunteer to do that, because I get a lot of men through my courses. And it's great. It's great that they're willing to get involved and do that. So.
Brilliant, thank you. Staying with you, Kathy, so we know that culture change won't happen overnight in the workplace, but how can employers start to create a more open and supportive culture where it's more acceptable to talk about mental health?
So some things that I've just mentioned already, like the town hall talks, the toolbox talks, putting posters around. So you're never going to change a culture overnight, but what you're doing is starting to say, this is important. Often you find that if managers, and particularly senior managers and directors, are willing to talk about this subject, the key message is, well, if you're willing to talk about it, then actually maybe I'm okay to talk about it as well. So it goes back to that role modeling. I was training a CEO in a company a few weeks ago, and he said, oh, every Sunday morning we go on the golf course, and we always have 20-minute check-in of all our aches and our pains and our backaches and our problems. And he made us all laugh because we're always talking about our balls. I don't think he meant golf balls at that point. But, you know, at the end of the course, he was saying, I think what we need to do is start talking about our mental health and actually just asking each other, how are you feeling? Because your physical and your mental health are inextricably linked. They are not separate. So why can we not have a conversation about, well, how are you feeling? You know, and I think it's partly because you can be scared of the answer. Well, actually, I'm not feeling great. But remember, we haven't got to fix people. You can't fix people. It's about listening and showing compassion and empathy, and it goes a long way to helping and supporting them. So, you know, and I'm just thinking about back to what you were saying, what else can employees do? Then yeah, it's just talking about it, making it part of day-to-day culture. The senior people risking opening up about their own mental health will go a long way to sending that message across the organisation that it's okay to talk about my mental health.
Brilliant, thank you. Is there anything you would like to add into there, Rob?
Just to reinforce the power of modelling these types of behaviours, and I think we mentioned it previously, but the idea that this is a broad organisational culture that we're trying to foster isn't just specific to a mental health topic. That if you can create an organisation where people feel psychologically safe, and you can test that, and you can see that in organisations where people can challenge each other, but they also share personal vulnerable stories together. If that sounds like your workplace, then you probably have a psychologically safe organisation. And in that environment where people open up and are vulnerable throughout the organisation and across the organisation's hierarchy, you are much more likely to be able to support people and engage people in conversations around mental health and physical health. But I wouldn't shy away from opening up and asking the questions about what could we do more of in this organisation to promote those sorts of conversations, rather than necessarily leading with a mental health thing. Just tell us how could we encourage each other to create a more supportive culture across our organisation, because that will then create the conditions with which these types of conversations can happen.
Brilliant, thanks Rob. So Kathy is about to share some advice for managers on how to start a difficult conversation. But before we move on to that, we're interested to hear your views, and we're launching another poll. So if you'd like to answer the poll, it is anonymous, and we're asking, if you had a mental or physical health issue, would you feel comfortable discussing it with your line manager or mental health first aider in your organisation? If you feel comfortable with adding your comments in the chat, please do. No one else in the audience can see them. So a bit of an open question, Rob and Kathy. If the CEO of an organisation has experiences of mental health, should they be sharing this experience with their employees?
Be very powerful if they were willing to do that, wouldn't it?
Yeah, so, definitely.
Remember, you know, when you share that experience, it's not, you don't have to give people the ins and outs of exactly what happened. What you can talk about is how you felt, what helped you recover, what supported you. And that sends a very powerful message that actually everyone can experience mental health. We don't need to know the ins and outs of it all, but actually if you're experiencing some difficulty, then reaching out to other people, talking about it, opening up, getting the right help and support can really help you get onto the road of recovery. So they don't, you know, I think the answer to that question, the CEO doesn't have to say, well, this is exactly what happened to me. It's not necessarily important. What is important is to share, I have been affected by it. This is what helped me recover. This is the support that I got. These are the services that I used. That sends a very powerful message.
I guess that can be the real drive of your culture change as well. If you know, if those at the top are willing to have that conversation, it's going to encourage everybody else to open up and give their experiences as well. So it would be quite a nice scenario.
I have seen people do it after the end of a mental health first aid course and share a little bit of their story, and they were quite taken aback by the overwhelming positive response that they got, because people connect with people when they tell their story and they talk about how they feel and who they are, and risking opening up and showing who you are and being vulnerable. And a lot of us want to avoid being vulnerable because it's a bit of a scary place to be, but actually opening up and being vulnerable is very, very powerful, and people connect with that vulnerability.
Definitely. Yeah. Some really interesting feedback that we've just had in the chat is, so somebody had mentioned that they feel comfortable approaching the wellbeing representatives in the workplace, but not necessarily the line managers. And the comment that they've had there is there's usually a lack of training and a lack of understanding from a managerial perspective. Is that something that's quite commonly found, or is that a bit of a surprise feedback?
I mean, I think from some of the research that we've done, that's common. It's more prevalent in organisations that are perceived to be hierarchical in their structure and also in their culture. This idea around sort of fear, shame, guilt, you know, it kind of drives and supports those insecurities. If you feel you're going to be judged, or that you feel you should be able to cope with perhaps the work demands that are being placed on you, that's consistent with that kind of perception. So training of line managers, training across the organisation is really, really important. I just want to make one observation about the CEO comment, because modelling is really powerful, but it's the heart with which the stories are shared that really make the difference. So if it's about driving a culture of openness and trying to encourage others, rather than necessarily, look at me, I had mental health and now I've recovered and everybody else can go, you know, the heart with which you share these narratives is really, really important. And that again comes back to kind of the culture that you're trying to create as an organisation.
Yeah, definitely. Thanks, Rob. So we'll quickly have a look at the results of the poll that have just come in. So as you can see, 73% of people have said yes, which is nice to see. 15% have said no, and 12% had left a not sure comment. So would you say that's kind of in line what you'd expect, Kathy and Rob?
I would say that's in line with exactly what we've just been talking about.
Yeah,
I'm intrigued by the final one is not sure, because does that
Not
point to people therefore not having conversations at all about mental health? So I'd be curious to know whether that was the case, or yeah.
I think the other thing that this data can do, I mean, I'm quite encouraged by that data, is that we know we take our cues about how we behave from how other people behave around us. This kind of idea around social norms. So if we're able to kind of push forward the message that, you know, 3/4 of our organisation are comfortable to talk about health issues in the workplace, that will in itself kind of perpetuate the narrative that this is a place where you can share those stories, where you can open up, because it's a normal thing to do. 3/4 of people in your organisation do it. It's a normal thing to do. So let's use that data and that insight to encourage others to engage, because social norms are really influential on how we behave.
So a quick question that's just come in on the chat function again. Do the panel believe that both men and women like to keep work life and mental health separate to avoid any possible hindrance in progression within their organisation?
I think it's down to stigma and discrimination in a very quick response to that. And I think that no, it shouldn't be separate, because we're human beings. So we're taking all of us into the workplace. So how can it be separate? But I understand that prejudice, stigma and discrimination get in the way of people feeling like they're not going to be able to progress. So I completely get why they don't want to do that. But hopefully if you start to change and shift cultures to one where people are okay to talk about their mental health in the same way they talk about their physical health, then that's the way it should be.
Brilliant, thanks Kathy. So one of the facts I shared at the start of the session is that men are more likely to use drugs and alcohol as coping mechanisms, and a lot less likely to talk to friends and family about their mental health. So it can be hard to know how to start a conversation about mental health. So what advice can you give to managers on how to start a difficult conversation with a member of their team, and how to check in with them on how they're feeling?
I think first bit of advice is don't shy away from it. Second bit is make sure that you're able to discern between performance and a well-being or mental health issue. So make sure you separate the two, because usually a manager would first be alerted to there being something wrong because performance dips. But remember that people don't suddenly become unknowledgeable, de-skilled and unable to do their jobs overnight. So what's likely is there's something else going on, and a good manager will spot that and say, look, let's just put your performance on one side, because that's where the fear will lie. You're going to fire me if I can't perform, and let's have a conversation with you about how you're feeling, what's going on for you. A good manager will know their staff, but appreciate sometimes managers are managing lots of people, so they can't always do that. But it's being willing to say, how are you, what's going on for you? I have noticed, and be factual, I have noticed these changes. Focus on what's changed. And again, it's going back to what I said before. People may still say, I'm fine, I don't want to talk about it. And if that continues, then unfortunately a manager only has performance as a way to address what's going on. But ideally, you want to exhaust as many possibilities before you get to that point of asking people, so how are you? Talk to me. I'm concerned about you. This is not about your job. We're not going to fire you. We're not going to performance review you down. Tell me what's going on. And if I'm not, and also I think managers be big enough. If I'm not the right person to speak to, then we have got other people in our organisation, like our mental health first aiders, like our wellbeing champions, like our colleagues. Go and speak to them. But, you don't need to be dealing with this on your own. There's lots of things that we can do to support you. And the other thing you can do on that is also be willing to say, here's some information. Maybe you've got an employee assistance program, you've got Westfield Health. So be willing to say, look, here's some information. If I'm not the right person, maybe this will help you. Here's a confidential service that you can access. So, but not to ignore it and just bury your head, because it won't go away. So.
Maybe if I could add to that, there's perhaps 3 or 4 really quick techniques that you might find that other people have found useful in having these types of conversations. And the first one is to kind of set the agenda with permission. So using phrases like, there's a few things that I'd like to explore with you, but I'm interested to know what matters most to you. Where would you like to start the conversation? The second technique is this idea around permission, asking, would it be okay if we spent a few minutes talking about how you're feeling more broadly than work? And that permission opens up conversations. And then if we use, it's a well-trodden path, this, we're talking about open-ended questions, but so many of the questions we ask that we think are open are actually closed questions. So being willing and encouraging people to open up by saying things like, could you tell me a bit more about, when you say things are okay, well, could you tell me a bit more about what you mean by that? And therefore just creating space for people to have these conversations and not being afraid of the silence that might come. It's probably about 8 to 10 seconds where people start to feel uncomfortable with silence. And if you can use that as a mechanism just to create a space for people to fill that void with their own words and their own narrative, that can be really powerful. And then the final one, that when it comes to actually action planning and what works, people aren't great at receiving advice if it's not been asked for. So one way of overcoming that is by saying, well, what other people have found useful in this situation is this. So you're not saying you need to do this. You're saying, actually, here's some things that have worked for other people. I'm just going to leave you to work out whether they might be useful for you or not. And so depersonalizing it, asking permission, and using these open-ended questions just to explore it more could be, again, really helpful in having these conversations.
Well, one final thing, Brad, one final thing as well, it is as a bit of advice, is people are really concerned about saying the wrong thing, and think if they don't understand enough about it and think they're going to make it worse. And what I would say to you is risk saying the wrong thing and begging forgiveness rather than saying nothing at all, because that's even worse.
Definitely. I guess it's just a nice reminder as well, using the sorts of language of saying other people have found this useful. It's quite a nice reminder that you're not the only person that's had these experiences, and you're not the only person it's happened to as well. So I guess that could be quite comforting as well.
Sure.
Yeah.
Brilliant. Thank you. Right, so moving on, we're going to be joined by one of our colleagues, John Joe, who works at Westfield Health. So John Joe's our e-commerce and B2C marketing manager. John Joe works full-time, but has adapted his working life to be able to take on more parental responsibility to look after his children. John Joe, do you want to share your story and how Westfield or your previous employers have supported this?
Yeah, thanks, Brad. So at previous jobs, and I guess when I actually started at Westfield Health, it was very much 9 to 5, 5 days a week in the office, and it worked for me then, and I didn't really know or sort of expect anything different from a job. But now at Westfield Health, we have flexible working, which means we have flexibility over where we work our hours and when we work them. So we've got an office in Sheffield, but there's no sort of set number of days that we need to be in. So I use the flexibility to work 5 days, my sort of full-time hours over 4 days, and on the other the day off. I say day off, it's not really a day off because I look after my kids who are 5 and 2. So I've definitely got my hands full at that time. And I often take my son to a playgroup on Friday morning where I'm usually the only dad there. So I guess that tells you something about sort of the traditional man's role in this. But I really value being able to spend that time with them and sort of play that role in their life as well. And when I do work in the office, when I do work my hours, I work 2 days a week in the office. It's a 30-minute walk for me, which is nice. It gets me out of the house. I can kind of clear my head and get some exercise. I also use the gym at Westfield Health in my lunch break, and it's really valuable for me to be able to sort of add that into my day as well. I do it regularly with 2, gym buddies, and it's nice to have the chance to sort of catch up with them and talk. So again, really nice to have that as part of my day. It also means that I can support my wife with her job. She's freelance, so sometimes she travels, sometimes she has meetings at other times, and being able to adjust my working hours or my day off, again, makes that sort of family life just run a lot more smoothly, and make sure that she can, you know, progress in her career too. It's really valuable for me to be trusted to work the hours and not have someone sort of hovering over me, or have that expectation that I need to be at my desk all the time. And that sort of trust definitely has an impact on my mental health, and alongside sort of improving my physical health as well. I definitely feel like they feed into each other. So, so yeah. The flexibility really works for me. Having that routine that works for me is really valuable, and I probably wouldn't at this point go back to sort of 9 to 5, 5 days in the office.
Brilliant, thanks, John Joe. Could I just quickly ask how your flexible working, how that's affected your kind of relationship at home with your family, like the positive impacts that that'll have had?
Yeah. Definitely, having been able to sort of flex my time means that if my wife has got a meeting, I can go and pick the kids up, or I can change my day off if she needs to do some traveling. So it just makes the whole thing run smoother, and means that all the sort of parental responsibility just doesn't fall to my wife, which I think, you know, may happen if I had to be in the office all the time.
Brilliant, thank you. And can I also just ask, so like you say, on your day off, you spend that quite a lot of the time for exercising. What's the impact of that if on your day off you don't manage to get any exercise in?
Well, on my day off, I don't really have that chance, because I've got the kids to run after. It's more during, when I'm in the office, that I have that. I mean, it's not, if I miss a day, you know, it's not the end of the world. But I suppose it is when then you miss more and more time that starts to impact. So I just, as I say, even though I have the flexibility, I do have a general routine that I like to stick to, and I think it benefits both mental and physical health.
Brilliant. Thanks for sharing those experiences with us, John Joe. Thank you. Moving on, quick question for you, Rob. So we know not all employers can currently offer flexible working hours or on-site gyms based on feasibility. Are there some other ways that employers could incorporate a level of flexibility or be more inclusive to offer support for their employees who have children or other care responsibilities?
Just a couple of really quick principles rather than specific examples. So the first one is trying to provide and promote that autonomy. John Doe talked about the value of that, being able to decide his own schedule and be in control of that. Recognizing that people have different needs and responsibilities, and some of those might be hidden, and therefore giving space to those and understanding, and buddy systems, connecting people in the workplace to be able to work on supporting, and particularly around activity, makes a real difference for people.
Brilliant, thank you. So just to summarise everything that we've discussed so far, so we've had some really interesting feedback on the session, and we're about to move on to some questions from the audience. So if you have any questions for our panel, please feel free to type them into the question box. To sum up what we've been discussing, we've talked about raising awareness and initiatives you could put in place to support men's health. We've also talked about ways to create a more open culture, role modelling behaviours, and how to start a conversation about someone's health. So a question for you, Kathy. So in the past, we've had a male employee's mental health deteriorate quickly to the point where he told us he'd become suicidal. How would you approach responding to this, especially for a hybrid business where you have this conversation over Zoom?
Gosh, yes, that's quite difficult. So first and foremost, take it very seriously. And then I would, and this is going to feel very counterintuitive because lots of people will fear that they're going to make matters worse, but I would want to know pretty quickly, has this person thought about how they're going to do it and when they're going to do it? So have they got a plan in place? And you know, I can imagine some of you are going, oh no, flipping out, I can't possibly ask that, but actually it's the right thing to do because you could save someone's life. So the first thing I think, even on Zoom, is to say, you know, okay, we're taking this really seriously. I'm really concerned for you. Clearly you're in a difficult place. Have you got as far as putting a plan in place? I.e., you know, when and how you're going to do it, because that will tell you how much of a crisis it is. So risk asking those questions, and then if they can answer that question, then that's what you call a serious crisis, and you would have to then get some help for them. Now, they may be quite concerned that they've actually spoken about it and they've told you that, yeah, absolutely, I've got a plan in place, and that you're saying, okay, well, we need to keep you safe. So either you need to ring your GP now and make an appointment, or I am actually going to ring somebody on your behalf and make sure that they turn up to check you out. And never, ever be afraid to ring 999 or 111 and send somebody to check out, because you know, this is serious. You could save their life. And when people talk about suicide, remember, they're not crying wolf, they're not attention seeking, they're saying, I'm in a desperate place and I need some help. So call it out, speak about it. Don't perpetuate the taboo around this subject by not mentioning the word of suicide, and asking them, okay, are you thinking about ending your life? Then let's get you some help, because it's important. And I think, you know, just to really hammer this point home, what would you rather live with? A few moments of gut-wrenching discomfort because you've just asked somebody that really awkward question, or a lifetime of regret because you didn't ask and then they did end their life? So I know it's more difficult when they're on Zoom. I 100% appreciate that. If they're close by, I would go and check on them. If they're not close by, maybe they're 100 miles away, or they might be in another country, goodness knows, I would still get some help. And whether you're in this country or another country, there's still global assistance available for people who are suicidal. So hope that helps.
Thanks, Kathy. Just another quick question. Are there any warning signs of possible mental health concerns employers could look out for, or colleagues could look out for?
This is going to sound a little bit trite, but I want to summarize that by saying what you're looking for is what's changed. So if somebody's normally very well presented and very cheerful and they behave in a certain way, and then that changes, that's what you're looking for. And remember, people are quite entitled to be quiet and you know, maybe more introverted as opposed to extroverted as a behavior. Doesn't mean they've got a mental health issue. Again, what you're looking for is what's changed, what's different, and never be afraid to ask somebody, how are you? And they may say, oh, I'm just a bit preoccupied, I've got this going on or that going on. Most of the time when you ask people and show genuine concern, then they will probably open up and say what's going on for them. So never be afraid to ask about it. And then the signs you'll see is what's changed. That's pretty much it, really, what's happening. And remember also, when I say what's changed, if you've got somebody that is fairly extrovert and normally outgoing, and they become even more so, that's a change. That's different. Because so when we talk about depression, for example, you can have something called the smiling depression. So people are hiding behind a complete facade and keeping it all in, and all their energy at work is invested in not showing people what's really going on. So if you notice that, call it out, have those conversations.
Brilliant, thanks, Kathy. Questions coming for you, Rob. So what are your thoughts on perhaps making mental health discussion as a part of appraisals, as a lot of staff can be quite quiet and only given one-to-one opportunities during these settings?
Yeah, I think that depends on the culture of the organisation. I think it's really important to separate performance from personal well-being in those types of narratives. One thing that we do at the university, for example, is offer people the opportunity to have a well-being chat and consultation, as part of their broader annual appraisal. And having those two things that are separate can be really powerful. But again, equally, if you have a really supportive line manager and a culture that's open and safe, then I think that can be a not good opportunity. Depends on the organisational culture.
I think it's good, just to add on that, it's good practice for managers to have regular wellbeing check-ins. So don't wait for the annual appraisal once a year to do that. Have a regular wellbeing check-in, a regular wellbeing review, because then people get used to it. They get used to the fact the first time you do it, they go, oh, they've been on a course, they've been asked to do that. But then you keep doing it and they go, okay, they're obviously interested in my wellbeing. So have those regular check-in wellbeing reviews.
Brilliant, thank you. One last question for you, John Joe. So do you feel supported to take time off with the kids when they are sick rather than it always being the mum?
Yes, definitely. I mean, I've got a very good relationship with my manager, and I know that she's got kids, and that, so I know that she completely understands if that had to happen. And I mean, again, in my specific situation, we've got 3 days of the week out of 5 covered with someone who's not working on that day, whether it be me, my wife, or my parents. And then the other days, my wife works half a day. So we kind of do have things in place to mitigate that, I guess, again, in my personal situation. But yeah, I don't feel like there'd be any problems or repercussions or any pressure if I needed to take a day because my kids were ill.
Brilliant, thanks John Joe. So it's now time for the webinar to finish. So thank you to everybody for taking the time to join us today, and all of the panelists for sharing their expertise. We're sorry that you didn't get the chance to answer all of the questions that's been asked, but we'll do some follow-up blogs on our website to try and cover some of the most common topics. So we know that we've covered some sensitive issues today, and we're sharing some men's health charities on the slide on the screen if you or someone you know has been affected by what we've been discussing today. We'd appreciate your feedback via our survey that will appear on your screen, and you will also soon receive the email with the recording of the webinar. If you'd like to speak to any one of our health and wellbeing consultants about supporting wellbeing in your organisation, please speak with your account manager if you have one already, or if you haven't got an account manager, you can contact us by email at businessinquiries@westfieldhealth.com. Thanks everybody.